Hi, I'm Dr. Carmine Esposito, talking to you today from All Creatures Animal Hospital. My assistant Mackenzie is going to ask us some questions about our canine patients and heart disease. Mackenzie, what's your first question?
Dr. Esposito, what does dog cardiology entail?
Well, cardiology for our dogs or cats, all our species, basically is a study and focus on our patients' heart health. Cardiology, heart, that's what it entails.
What are the most common cardiovascular conditions you see in dogs?
So for our dogs, our most common cardiac condition is valvular disease. A lot of times our dogs have mitral valve disease, especially as they get older. Our other common cardiac disease with our dogs is DCM, dilated cardiomyopathy. Those are likely our two most common cardiac diseases.
Are certain dog breeds more at risk for heart-related conditions?
There are some breeds that are more prone to some cardiac diseases than others. Our valvular disease that we see seems to be very prominent in most of our dog breeds, but we do have some that tend to have more probability of disease than others. Our Cavalier King Charles is one. Some of our boxers and Great Danes are some of the other breeds out there, but many breeds are predisposed to cardiac disease.
How soon should I bring my dog in to see a veterinarian if I suspect that they have heart disease?
Well, if you suspect they have heart disease, we should bring them in sooner than later, and we should assess that. I guess my question would be, why would you think that they have heart disease? One of the other heart diseases that I did not mention, but dependent on where you live in the country, especially us here in Texas, heartworms is an infectious process that causes heart disease, and that is another one of our more common heart diseases here in Texas.
Can a dog have a heart attack?
Heart attack, as a general term, I guess, yes, we can. We can have an event that can cause the heart not to function in a way that would sustain the dog's life. And so we can have disease processes that could prevent the dog from having what we would call a quote heart attack. It's a little different than most people heart attacks that we think about, but yes, we can have that.
Can dogs live a normal life with heart disease?
They can. It would depend on at what stage they are. We do stage heart disease in our dogs, and depending on the stage and depending on their clinical symptoms, our presentation would dictate how it would be managed and what their prognosis would be. Also, depending on their clinical presentation, if medical therapy was warranted, how they respond to that medical warranty therapy would warrant a prognosis of better or worse prognosis down the line.
What is congestive heart failure and how does it affect dogs?
So congestive heart failure is congestion in our dog's lungs, that they get fluid on their lungs that prevents them from exchanging gas, oxygen well enough to be able to breathe well. That is typically caused from a cardiac disease process that is preventing the heart from pumping efficiently.
What are some common signs of heart disease in dogs?
Some of our dogs can have heart disease and have no symptoms. They can be asymptomatic. Many of our dogs that present and are tested for heartworms and test positive, they can have heart disease, cardiac disease, and be asymptomatic at the time of testing and diagnosis of the heartworms. We can also have clinically symptomatic dogs that are having trouble breathing, having exercise intolerance, coughing a lot more than typical for them. They can have anorexia. So there are several symptoms that we could see, but they can be asymptomatic.
How will a veterinarian go about diagnosing dog heart disease and other cardiovascular conditions?
So the mainstay to most of our diagnostics for our cardiac workups are going to be chest x-rays, EKG, an echocardiogram, blood pressure, and there are some blood tests out there that we can run to assess the heart.
What is the treatment for congestive heart failure in dogs?
It'll depend on their presentation, but most of the time it's supportive care. Depending on when they present, how much respiratory distress they're in, they may require supplemental oxygen, usually diuretics, and depending on how poor the heart is functioning, they may need some medication to help the heart start pumping better, to allow for better perfusion.
How often should my dog be checked by a veterinarian if they have a heart condition?
Based on the stage that they're in, there may just be every 6 to 12 months they need a follow-up. If they are not stable or they're at a more advanced stage, then the recommendation would be certainly more frequent checkups.
Can exercise benefit dogs with heart disease? And if so, how much?
Again, that would depend on the stage of the heart disease that they're in. If they're asymptomatic, then we would want the dog to be able to exercise and do what they feel comfortable doing, so within the dog's limits. For our more advanced cardiac patients that really have exercise intolerance, limited exercise is probably warranted at that time. Again, within the limits of the dog, so we really ask that the owner look at and listen to the dog and really allow them to dictate how much exercise that they should be exerting. This is an overview of cardiac heart disease in our dogs. There's many more topics and much more in-depth information that we would love to share with you. If you have any questions about it, please call us at All Creatures Animal Hospital.